Hello all. Today's topic is COPD, that is chronic obstructive pulmonary disease. It is a term for lung and airway diseases that restrict breathing. People with COPD have airway inflammation and scarring, damage to the air sacs in their lungs or both. Emphysema and chronic bronchitis are both forms of COPD. Then, definition. Chronic obstructive pulmonary disease is a term for certain type of irreversible lung and airway damage that block airways and make it hard to breathe. If we are diagnosed with either emphysema or chronic bronchitis, may have COPD. Then, risk factors. The risk factors of COPD includes smoking, air pollution, occupational dust, and genetic factors. The next is pathophysiology. First of all, chronic inflammation, then airway narrowing, then alveolar destruction. Then clinical features. The clinical features includes cough with mucus that had for a long time, difficulty taking a deep breath, shortness of breath especially when performing daily activities or mild exertion, wheezing or other lung sounds, bluish skin, cyanosis. Then causes of COPD. Causes of COPD are damaged lung from smoking is the common cause. Then it may be due to genetic disorder, that is alpha-1 antitrypsin deficiency, second-hand smoker, toxins in the air, exposure to dust and fumes from jobs or hobbies. Then types of COPD. Types of COPD includes chronic bronchitis and emphysema. First of all, chronic bronchitis. It is an inflammation in large airways. This narrows airway and makes lots of mucus. Cough is the most common symptom. Then emphysema. Emphysema is when alveoli become damaged and enlarged. The most common symptom is shortness of breath, that is dyspnea. Then investigation. Investigation include pulmonary function test that provides spirometry and other tests to see how well lungs are working. Then pulse oximeter. This test uses a device on your finger to measure oxygen levels in the blood. Then imaging tests like chest x-ray and CT scans look for lung changes caused by COPD. Next one is arterial blood gas test. This is a blood test that checks oxygen and carbon dioxide levels in the blood. Then exercise testing, electrocardiogram. This test checks heart functions and rule out heart disease and causes of shortness of breath. Then genetic testing, blood tests. Then management. Management of COPD includes, first of all, we should stop smoking. So smoking is the most common cause for COPD. Then inhaled medications like bronchodilators, inhaler and nebulizer, oxygen therapy, pulmonary rehabilitation, corticosteroids, positive airway pressure, antibiotics, lung volume reduction, clinical trials are done. Then how can we manage by lifestyle? Smoking cessation, pulmonary rehabilitation, breathing exercise. Complications and prevention. Complications include respiratory failure, pneumonia. Prevention: stop smoking and start early treatment. Thank you.